Okay, since it is 10 o'clock, we'll go ahead and get started. I know the screen says Ann Silver, but I'm Connor Nesbitt, the Director of Operations here at the Reno+Sparks Chamber. Christine Brown, our Director of Member Engagement, is also on the call. And I'd just like to thank everyone for getting on this webinar. We've been working on this for quite some time and are excited to have our association health plan back. I'm not going to take too long. I just want to introduce Lindsay Dixon. She is the Director of Business Development for Prominence, and she will go over her slides here. So Lindsay, I will go ahead and pass it on over to you.
Thanks, Connor. Thank you again, everybody, like Connor indicated, for getting on the call. We're hoping that this is informative for you. We are going to have some additional sessions and some face-to-faces, and we'll talk about that towards the end. But really just thank you so much for getting on and getting engaged and learning more about the Reno+Sparks Chamber and the opportunity with the partnership with Prominence Health Plan, and then a huge shout out to Clark & Associates as well. So I'm not a distraction. I'm actually going to turn off my camera, and just if everybody else can make sure they're on mute as well. We will open up at the end for questions, and if you do have questions throughout the meeting, go ahead and make sure that you put them in the chat box. So without further ado, I'm going to go ahead and get started. So as Connor indicated, we're back with respect to the remarketing of the Reno+Sparks Chamber effective 3/1 of 2021. So really excited to be able to open this back up and be an opportunity for prospective Reno+Sparks Chamber members, and then also some affiliate programs that we're going to talk about here in just a moment. There we go. So just a couple things we want to touch on with regards to our agenda today, just re-circumventing Prominence, the partnership, why an association health plan, talking about some of the network strengths, as well as some of the upcoming events that we talked about a little bit earlier. So just a little recap on Prominence for those of you that may not be familiar with Prominence, or maybe just need to look about Prominence Health Plan. We are the sponsored health plan behind the engine of the Reno+Sparks Chamber. And for some of you that may or may not know some of the history of Prominence and who we are, many of us may not have actually heard Prominence Health Plan, but maybe have heard of Universal Health Services. And we are actually owned by Universal Health Services, one of the largest hospital systems across the country, with over, actually I think it's over now, 400 acute care hospitals, including behavioral health care facilities across the United States and even internationally. So we are able to tie that and correlate back to our integration up in the north with our Northern Nevada Medical Hospital System, and soon we're really excited about our newer hospital opening in 2022. And then down in the Las Vegas market, our correlation with the Valley Health Hospital Systems in Las Vegas, as well as Desert View out in Pahrump. So a great combination with a local presence from a routing standpoint of the health plan, but our national wings promoting outside the states with our hospital system as our partner. So with respect to Prominence, we're a local regional player, but we do have capabilities with our national breadth network, which I'll talk about a little bit later. But really a huge opportunity to change the delivery of healthcare with having more of a local stance and be able to leverage our network capabilities with our hospital strength, as well as really being able to recreate the wheel with local innovation like we have with the Reno+Sparks Chamber, offering flexibility, and which hugely we applaud is having local leadership. I think a huge proponent of innovation and flexibility is the strength of having local leadership sit in both our Reno market and our Las Vegas market. So why association health plans? Why bring the Reno+Sparks Chamber back to fruition as an opportunity for small employers? And really that's what we want to hone in today is why association health plans, and how is Reno+Sparks Chamber set up, and how is it going to flow through the remainder of the effective date? And we'll talk about what those effective dates are in just a moment. So the biggest proponent around why association health plan is truly the ability for multiple small employers, group size 2 to 50, are able to join together as one entity and have larger buying power. Truly, the affordability component is a huge issue. I know with small employers being able to afford insurance. So being able to offer a multifaceted benefit arrangement as well as a less expensive option, and being able to offer benefits that are really more flexible and able to administer on the small group side is truly why we have helped put these association health plans together, and really excited about the new opportunity with the Reno+Sparks Chamber. So we didn't fully recreate the wheel with respect to the current platform that we have with Reno+Sparks Chamber that, as you guys know, we're not actively marketing. But the new platform we are able to market effective 3/1. There'll be 6 health plans to choose from. And the great thing is, again, we didn't reinvent the wheel. So we really kept the same platform plans that we have on our existing book today, but we are able to enhance some of the benefits. And I'll talk about that, what that looks like in just a moment. But what we were able to do in order to meet the approval of the DOI and the Department of Insurance and the Department of Labor was to create industry-specific committees in order to continue the path in reopening the Reno+Sparks Chamber. And that was really one of the proponents as to why we had to demarket Reno+Sparks Chamber, is because it wasn't industry-specific and it didn't meet the guidelines set forth that were changed with Pathway 1 and Pathway 2 set by our DOI and DOL. So we now have 3 industry-specific committees. We have our service industry committee, we have our manufacturing industry committee, and then we have our transportation industry committee. All 3 of those committees are open and available for new enrollment beginning 3/1 of 2021. And then it will have an anniversary date of September 1st, 2022. So it's basically an 18-month rate guarantee through those 18 months. And we'll talk about a little bit further through the presentation what we can do with existing groups. Existing groups can roll over as well, but we'll talk some of the components on how that's going to work in just a moment. So I know this is somewhat of an eyesore, so I really just wanted it more for a visual. We do have a benefit guide that's available, and it's out on the Reno+Sparks Chamber's website, as well as it'll be publicized on Prominence's site, but the benefit designs amongst that brochure, what you're seeing here, and basically the items in red are the enhanced benefits. So, and I have a slide coming up, but basically, again, we're not reinventing the wheel with the current platform plans. We are just enhancing the benefits. So we have an HMO plan, 3,000 deductible, an HMO 4,000 deductible, a high deductible health plan, 3,000 100%, which I know a lot of people are really excited that we're not changing that. It'll continue to be the same plan design. We have an HMO Freedom 3000, which I'll talk to what a Freedom is versus a traditional HMO. We have our PPO $2,000 deductible plan. And then we have a high deductible PPO plan that previously was a $4,000 deductible, which is now a $3,000 deductible plan. So really truly valued benefits that we felt that with the current platform of plans, we didn't want to reinvent the wheel and keep them as close to current, but really looking at some of the benefits where we can make some enhancements and make some changes. So here are some of the featured, or actually all of the featured changes with respect to the plan designs available 3/1 of 2021. We heard you loud and clear that some of the out-of-pockets were a little too high. So for 3 of the plan designs, we did move down the out-of-pocket maximum from $8,150 to $7,500. And then also formulated that over to 2 times on the family. Additionally, for ER and diagnostic services, prior plans, they had calendar year deductible and then $1,000 copayment. We've removed that calendar year deductible, and now those services will just have that $1,000 copayment. So definitely an added bonus there. Again, with the HMO high deductible health plan, we heard loud and clear, please don't change that. Everybody likes the 3,000 100%. So that plan will continue to roll over to the new platform unchanged. And then again, the PPO HD 3000 used to be the PPO HD 4000. So we basically just lowered that deductible to accommodate a better lineup from the platform of plans. Again, making sure that we are being sensitive with plan design and making sure that we have the appropriate bells and whistles amongst the plans. So all of our HMO plans are open access. A lot of people think that we're a closed panel, that there's the dictatorship with the primary care. Truly, and on all of our HMO plans, the members in their own driver's seat for their care. They can self-referral. There's no referral process. Really, you don't even need to pick a primary care. It's truly the members in their own driver's seat for not only HMO, but even the PPO. Great mix up with respect to the co-payments, deductibles, and co-insurances. Really wanted to be mindful in setting those, and again, trying not to reinvent the wheel and keeping those as close to where they were previously. Our PPO network, as well as our HMO Freedom network. So we basically have a HMO plan on steroids, if you will. It's an HMO Freedom is a national network HMO, as well as our PPO network. So you can actually access benefits outside the state by accessing a Cigna provider. That's whether you're traveling, that's whether your dependents are residing outside the state, or if you just want to go outside the state and you're on an HMO Freedom plan or a PPO platform plan, you have that flexibility and choice to access the Cigna network outside the state. Again, we do have a couple of the high deductible health plans. If you're an employer or you have an employer that's looking for a tax qualified option, we do have a handful of those HSA qualified plans. All of our plans include Teladoc, which is our telemedicine benefit platform, which we all know through the COVID times has been a very favorable option. So all of the plans do include that as $0 copay. Some of the HDHD plans will be subject to deductible co-insurance. But really making sure that we have a great outline of plans available on the Reno+Sparks Chamber that are not only affordable, but also make sense with the price points. So this is really huge, and I think a lot of people, I don't know, discount this or maybe just forget about this. So the Reno+Sparks Chamber platform of plans is available for the Reno+Sparks Chamber in the Carson, Washoe area, but in additional, we have affiliate programs. So this is not just for the Reno+Sparks Chamber members. If you're an affiliate of any of the other Chamber of Commerce's in our filed service area, which for 2021 will now also include Lyon County, you would pay the affiliation fee to join, as well as you have the capability to join the association health plan. So Carson City, Washoe County, Douglas County, Story County, Clark County, Nye County, and now again for Lyon County. So if you're a Pahrump Chamber member, or you're a Henderson Chamber member, or you're a Las Vegas Metro Chamber member, if you do sign up via that affiliation program, you are eligible for these platform of plans. So diving in a little bit more to the industry specific committees, we wanted to make sure that the committees were set up appropriately. So again, we were fulfilling the needs of the Department of Insurance and the Department of Labor to making these industry specific. So what we've actually done is based on SIC code ranges. SIC code stands for Standard Industrial Classification. These are the actual codes that businesses affiliate themselves for the type of business. So they actually are filed SIC codes, whether you file with OSHA, whether you file with the state of Nevada, what have you. This is what we are determining to utilize to plug you in the appropriate rate buckets and committees. So based on the range, we determine which committee you are eligible for. We will note that not every single SIC code is eligible for the Reno+Sparks Chamber. I just will point out that the construction SIC codes are not listed. We do have a partnership with the builders. And if you do file into one of those construction SIC codes, we will funnel those appropriately as an option to one of our other association health plans. So again, not all SIC codes are permissible, but we are showing here how those SIC codes do standardize across the committee scope. Again, an eyesore, and I'm sure if you're a broker on the call, you know this eyesore very well as some of the HR administrators. So this is what standard small groups see today, and really why it's important to offer an association health plan. For small groups with respect to ACA, all small employers 2 to 50 have the availability to sign up on the small group platform, but they are subsidized with standard age rated group. So basically what that means is for each employee and their dependents, I think it caps out at 3, some carriers are different, actually have to use the age tables to figure out what your rate is for a specific plan, which really can be unpredictable because we all unfortunately have a birthday every year. We all get older every year. So your rates are not necessarily locked in. And really from an administrative standpoint, when they're individually rated, if you have multiple employees, multiple plan designs, can be somewhat cumbersome to administer, not only from an administrative standpoint, but also on the broker side. So really important amongst the association health plan and what we've set up with the Reno+Sparks Chamber is a more predictable format. So again, once it's determined which committee you fall in based on SIC code, we then plug in the age sex factor of the group, or the age and the sex of the group, in order to determine an age sex factor. And then based on those 3 components, we are able to populate rates, not age banded, but composite rated. So you get an employee rate, employee plus spouse rate, an employee plus child rate, and employee plus family rate for the 6 plan designs. You're not trying to figure out employee male over here at 33 is this rate and female over here is this rate. They are all composite rates, which make it very easy, predictable, and easy to administer. And additionally, they're locked in. So if somebody is changing a birth date, they're not going to change midstream. These are your rates, again, until September 1st of 2022. So, okay, great. We talked about the plans. We talked about the benefits. We talked about who UHS is and the partnership with the Reno+Sparks Chamber. What does the network look like? So again, just I'm hitting on the north and predominantly in the Carson, Washoe area. As you guys all know that I kind of spoke to before, we obviously have our own health system with Northern Nevada Health System, as well as our new hospital that we are thoroughly excited for with the Nevada Sierra Medical Center, which are hoping will open mid-2022, but also align ourselves appropriately with some of the other hospital systems. So you're the Carson Tahoe, the St. Mary's Health, as well as an array of hospital systems in our rural areas. But in addition, it's really also important because the Reno+Sparks Chamber does align throughout the state with the other service areas that we are filed for. In addition, we do have a strong network down in the Las Vegas area, utilizing our own health hospital system, again, through the Valley Health System. We also partner with UMC, North Vista, Boulder City, and then again out in Pahrump, we have our own Desert View Hospital System out in the Pahrump area. Taking it one slide further, not only do we have our great partners amongst the hospital system, we also have our partners outside of the hospital system with different partnering medical groups. Obviously, these are not all of them. If we put them all on here, I think the slide would be very jumbled and hard to read, but just wanted to highlight on some of our bigger name hospital, or I should say out of the hospital partners, as well as an array of urgent care clinics, minute clinics, and then some of our freestanding facilities. We actually just opened one up in Reno, one of the freestanding ERs, and we have a couple of down here in the Las Vegas area as well. Additionally, we recently launched our partnership with Dispatch Health up in the north. We've always had it down in the south. The Dispatch Health is basically urgent care on wheels, where they actually will come to your home or place of work and actually facilitate a house call in the own comfort, privacy of your home, or whether it's in your work. But it's a great opportunity. It's at an urgent care clinic, as well as teledoc, which I talked about a little bit earlier. Again, if you are on a high deductible health plan, it might not necessarily be at a $0 copayment. And then again, touching on our national network strengths, kind of talk to it again with the Cigna component. So again, if you have employees outside the state, or you have a dependent outside the state, or you just want to go outside the state for care, if you're on one of these 3 platform plans, PPO, or high deductible health plans on the PPO, or HMO Freedom, you do have that flexibility and choice with the Cigna network subsidizing you outside the state. And last but not least, want to always make sure that you know that for the dental, vision, and life, the benefits are not changing. The rates have been guaranteed until 2022. So the same options will be available moving forward through Kansas City Life. Okay, so we've heard about what the benefits are, how they price out, what the network is. What do I do next? What are the steps that I need to do next? So the great thing about an association health plan is that it's rolling. So you don't have to wait for your renewal to come on, meaning if you're not currently a Reno+Sparks Chamber member, you can come on at any time. It's a rolling effective date, so you can lock in now until September 1 of 2022. So you can work with your broker. If you don't have a broker, you can contact us or Clark & Associates. We'll have some of those contact numbers at the end. But again, you don't necessarily need to wait for your current enrollment or renewal with your current carrier. If you have an Anthem or an Aetna or a United, you can enroll now. If you're a current Reno+Sparks Chamber Health Plan member, so you're currently on Prominence and you're currently under the Reno+Sparks Chamber platform of plans, you don't have to do anything today. You can continue on the platform plans until 9/1 of 2021. However, 9/1 of 2021, you will need to roll over to this new platform, and we will release out those appropriate plans and rates, what have you. Now, if you do want to move over earlier, that's great. We can work through your current broker. You can work through Prominence. You can work through Clark & Associates. You can work through Reno+Sparks Chamber, and we can help guide the appropriate steps if you do want to move over sooner. But again, you don't need to do anything today. You can stay on the current platform plans until 9/1 of 2021, of which those will expire, and you will need to move to the new platform 9/1 of 2021, which will be locked in until 9/1 of 2022. So again, I kind of already gave away my own thunder here, but here are some of the contacts. You can always go out to the Chamber's website. Again, you can always contact your current broker if you are working with a current broker. You can contact Prominence if you're looking for a quote or any information, as well as reaching out to Clark & Associates if you don't have a current broker. This information will be also saved out on the Reno+Sparks Chamber platform on their website as well. So if you're not writing it down, don't worry, we'll get that saved out there as well. And then again, if you want to come listen to us again, or you have a friend or somebody else that you think might be interested in hearing more, we do have another session. It'll be exactly like this. I might just talk a little bit differently, but for the most part, it'll be the same as you're hearing today on Friday, March 12th. We also have 2-person events up in the, at the Reno+Sparks Chamber on March 17th. From 11 to 12, there is limited space, so an RSVP is required. And again, you can find that through the Chamber's website. And then again, another in-person event on Thursday, March 18th. Again, a limited number of folks, again, just due to COVID, but we'd love to see your face. And if you have any additional questions or concerns, you can always bring those to those meetings as well. But with that, I'm going to go ahead and open it up to Connor to see if there are any questions in the chat box.
Thank you, Lindsay. I don't see any questions right now. I did just want to let everyone know I will be putting our website in the chat box that has the direct links for all the association plans. So what I'll do is kind of give everyone a little bit of time. I know everyone is probably listening to you, Lindsay, and trying to absorb as much information, so they may not have had questions, but they are starting to roll in here. Lindsay, are those slides available so that we can send that out to everyone on the call? Or is there, I just had someone that did want to go back, if you could possibly go back through some.
Go back through a slide?
Yeah, I believe slides 15 and 16.
Sure. Bear with me. We're going to get a quick snapshot. Press, they load it down. And this will also be in all the marketing communication as well. So here is 15. So this is just a snapshot of what the composite rates look like. This is the exact formula, just a snapshot. And then here's 16. Hopefully I'm sparking a question. Maybe that's not the right slide, but here's 16. Am I on the right slide? Maybe whoever has a question, feel free to come off mute.
Yeah, Heidi, is that the exact one you were looking for?
We are going to post this to Reno+Sparks Chamber's website, like Conrad indicated. Again, also this benefit guide, if you are a broker, this has been sent out as well, but we'd be more than willing to share whatever you guys need in order to appropriate the armed with the right tools. So I have no problem sending this out, Connor, if folks want to have the actual presentation.
Yeah, you made a good point, Lindsay, about we will be posting this webinar on our YouTube page as well. So anything that was missed or you want to go over that again, that will be on our YouTube page, which will also be linked directly through our association section on our website. So Lindsay, a couple other questions that are coming through is about how the deductibles are managed. If you are already with Prominence, can you go over the deductibles a little bit?
Sure. So if you're a current Prominence member and you're coming up for renewal, we will credit the appropriate deductible. So if you've already met any or all of the deductible in the calendar year, so if you renew, let's say you renew 9/1, any deductibles that you met January 1 through August 31st, if I can do my math right, we will credit anything prior when you start over on 9/1 of 2021. Also, if you're coming from a prior carrier, and you're coming over to Reno+Sparks Chamber, we'll also credit prior deductible as well. So if you're coming over to Reno+Sparks, let's say you want to enroll on 5/1 and you met any or all of your deductible with the prior carrier between January 1st and April 30th or 30 days in April, we'll credit that deductible as well from the prior group insurance. Great question.
Does anyone else have any questions they'd like to put in the chat or possibly unmute if we can try that? I know sometimes that gets a little hectic, but Lindsay, real quick, Georgina wanted to ask about the OOP max.
Mm-hmm.
Can you go over that a little bit?
Yeah, so let me go back to one of the slides. I'm going to assume that it's with regards to the enhancement.
Yes.
Sure. So the 3,000 HMO, the HMO Freedom 3,000, and the PPO 2,000 previously had an $8,150 out of pocket. So we've lowered that out of pocket, so there's less exposure as a member to $7,500 as an individual and $15,000 as a family. Hopefully that's answering the question.
All these now. Georgina, did that answer kind of the question you were looking at?
I'm going to assume yes.
I'm going to assume, yeah. And then I do have another one here about the out-of-pocket being credited if you're already with a PHP,
Yes.
or if you're moving from another carrier. Can you
Yes.
kind of go over that?
Sure. So it's our general, I guess, opportunity for you, whether you're a current Prominence member or a member moving over to Prominence. We do credit deductible and out-of-pocket in network only. So whether you're a current Prominence member going onto the new platform or you're a new member over to Prominence from an existing prior carrier, we do credit in-network deductible and in-network out-of-pocket from the calendar year. So again, anything starting January 1st going forward.
Thank you. I think that answered a few of those questions, so that that really works. Does anyone have any other ones in the chat? I'll leave it open a little bit. I do want to just, if there are some other questions, give a big shout out to Lindsay with Prominence and Valerie and Melissa with Clark & Associates. Also Andrea as well with Prominence. I appreciate all your guys' work on this. I know it's been some sleepless nights, so I appreciate all your hard work and presenting this to everyone. And like I said, we will get this information out on our website and make it available so everyone can kind of go over this at their own pace. But it's good to have some questions while we have you on the call. The rates are available right now. Is that correct?
Yep.
As of March 1st.
Yep. So feel free, submit over a census. We can start quoting you. Utilize your broker. Or if you don't have a broker, again, you can reach out to Prominence, reach out to Reno+Sparks Chamber, reach out to Clark & Associates, but we are available now. So don't wait.
Awesome. I think that's it with the questions for now. If anyone does have any additional questions, I will be putting my email in the chat here. Feel free to reach out to me at any time with any specific questions. If it's regarding the plan or chamber, you're not already a chamber member and want to join, I'm happy to have anyone shoot me an email with any additional questions, and I can relay them to Lindsay and anyone over at Prominence and get those answered for everyone. So with that, Lindsay, any final comments or anything you'd like to leave the group with?
No, just want to thank everybody for your time. I'm sure you had an option to go on a multitude of other webinars, so we just appreciate you taking a few minutes out of your day and listening to the new opportunities. So thank you very much.
Thank you, Lindsay. And thanks everyone again for getting on the call. And we will be posting this information again, like I said, to our website. So if you want to go over that again, you will. And we'll have another one on Friday. So if you know someone that wasn't able to make it today, we'll have those Friday and then in-person ones as well, as Lindsay explained. So I appreciate everyone getting on the call, and hopefully we'll see everyone soon. So thanks again.
Thank you.